Professor Margie Danchin from the Murdoch Children's Research Institute at the Royal Children's Hospital is joining us today to discuss COVID-safe information, particularly in relation to young children with disabilities and their families. Hello, Margie. Good to have you here.
Good morning, Kerry. Thanks so much for having me.
It's our pleasure. Would you like to introduce yourself a little to the listeners?
Absolutely. So I'm a paediatrician at the Royal Children's Hospital in Melbourne, and I'm also a vaccinology researcher, which means I do research in all things vaccines. And particularly, I've been very involved with the COVID-19 vaccine rollout here in Victoria. And I actually was seconded to the Department of Health last year. And one of my main roles was actually working closely with the department to understand the needs of parents and their motivation to get their children vaccinated and how we could best support children and their families for children to get vaccinated, and particularly children who are at higher risk of severe COVID infection, which we'll talk about a little bit later. So the main focus of my work and my research is around building confidence in vaccines and looking at ways to get high vaccine uptake in groups and populations who are at greater risk and who need those vaccines the most.
Yeah, great. Well, let's talk about those people who are at risk a little later. But first, can we start by talking about children and COVID? What are the risks of children getting COVID?
Yeah, and this has been something that obviously, everyone has been witnessing children getting COVID infection. We've seen that a lot more since the Omicron wave in sort of December, January, February this year. And I think most of us can see that children do not get that seriously unwell from COVID infection in the most part. And that in some ways, COVID is like many other viral respiratory infections that children experience. But in fact, COVID is a more complicated virus, and it is something that we need to understand that kids can get very sick from COVID infection. And when we say very sick, what do we mean? So yes, in the most part, children will get a runny nose, a fever, a cough, some aches and pains. But a proportion of children may need admission to hospital because they can't drink as well for some fluids, or they might get some respiratory infection and need some support with oxygen or even some antibiotics if we're worried that they might have a bacterial infection alongside the COVID infection. And then, children can also get more seriously unwell and need to go to the intensive care unit. And we've seen that more with a strange condition called pediatric inflammatory multisystem syndrome, or PIMS-TS. It's a bit of a mouthful, but what that actually means is some children can get this severe inflammation of many organs in the body, and they can get very sick. It's quite rare. It happens in about 1 in 3,000 kids or so. But this PIMS-TS syndrome is nasty, and kids need support in ICU and more intensive treatment. And it happens about 2 to 6 weeks after the acute infection with COVID. It's not straight away. But that is one of the more severe complications of COVID infection. And then, of course, we are also concerned about some children that may go on to experience longer lasting or chronic symptoms from COVID infection, something that is called long COVID. And we can talk about that a little bit more later when we talk about maybe the benefit of vaccination. We know long COVID is a lot less common in children than adults. It happens in maybe 1 to 2% of kids. But of course, we don't want children to get COVID infection and then 2-3 months down the track still be experiencing symptoms, whether it be fatigue, respiratory symptoms, headaches, and those sorts of things. So I think COVID does have a direct impact on kids' health. And as I said, in the most part, children experience it as a respiratory infection, but there are these more severe complications that kids can get. And unfortunately, those complications are more likely in children with disabilities, for example.
Can you talk a bit more about that, Margie, about how that affects children with disability?
Yeah, and this is a really important thing to be aware of, and it will also, you know, underpins the recommendations for vaccination, particularly in children under the age of 5. But we do know that children with disability, particularly those who require assistance with their activities of daily living, for example, kids with cerebral palsy, or children with Down syndrome as well, are at higher risk of getting sicker with COVID infection. So needing to go to hospital and potentially needing support in hospital with fluids or antibiotics or other measures. But it's not only children with disability that are at higher risk, it's also children who have a lowered immune system, something we call being immunocompromised, and that might be because of medications they're taking that suppress the immune system, or it might be because they have an illness that affects their immune system, you know, such as, for example, cancer, and the treatment that you have for cancer can suppress a child's immune system. And there are also specific conditions that affect the child's immune system directly. And then the third big group of kids who are at higher risk are children who have complex or multiple health conditions. And what do we mean by that? Things like kids who have complex congenital heart disease or neuromuscular conditions or chronic lung disease, type 1 diabetes. And of course, a lot of children who have disabilities also have other health conditions as well. So a big sort of thing for parents listening today to be aware of is that these children are at higher risk of getting more severely unwell from COVID. And these are the children in particular that we would like to see receive the recommended doses of COVID vaccine.